So we're going to go ahead and get started. Like I said, I'm recording this so it can be for future review. Um, Last week I did the same training, and last week I did a training on a narrative, and it was a CA-1, and that is recorded, and we'll post that. But since I did a CA-1 last week, today when we go over training, we're going to do a CA-2, just so you can see that difference, and you guys can feel free to access that other training that I did as well. We'll make sure that ends up on the portal for everyone to see. So we don't have a lot of people on here. So as I'm going through, if you have a question, just unmute and ask. I don't think it's going to cause a lot of interruption. If it does, then we can divert to just throwing a question in the chat, and I'll try to see it. It's just when I start, get in and start writing the narrative with you all, sometimes I won't exactly look at the chat. So maybe Troy, you can pipe up if someone has a question. Or if in Zoom, there's a raise your hand feature where you can raise your hand, and then it will alert us to know that you have a question, and we'll go through this. So what I'm going to do is I'm going to share my screen. We're going to enter into the dashboard, and then we're going to write a narrative together. Like I said, today is going to be a CA-2. This is a fake patient that I had AI make up for us, so there's no HIPAA anything. I'm going to take it slow. So sometimes when people first get introduced to this dashboard, sometimes I go really fast when I explain it, but I'm going to slow it down today. So if it gets boring for you because you've been doing this a while, just bear with me. I'm slowing it down for others who may watch this, but hopefully it's informative and we learn a few things. Okay. So give me a thumbs up if everybody is ready to start writing a CA-2 in the wizard. Y'all good? Okay, so we're gonna share my screen. Okay. Very good. Okay, so everybody see my screen here. So this is your wizard. There's a lot to the wizard I'm sure you guys have seen through, but today we are focusing on just one thing, and that is this new injury narrative button. This is where we're gonna focus. So also I would like to know, does everybody in here use Quick EMR? Throw in the chat if you use something different. Or does everybody use this Quick EMR? Because I'm going to show you kind of in real time, because I still help write narratives for our St. Louis location. So I just want to show you how I do it. You may have some different nuances in how you do, but I want you to see in real time how I'm going to go about writing if it's an actual narrative for my clinic. So first thing I'm going to do is I'm going to hit new injury narrative. So this is going to open up the information that the wizard is going to need to write your narrative. And then what I do is I go to my EMR and I pull that information that's needed. So I know that we have our patient name here, Miss Sarah Jackson, and she's a distribution clerk. So I'm going to come over here, and I got Sarah, she, her. Let's see. This is what happened to Sarah here. Looks like she reported her injury on August 1st, 2023. So I'm coming back in here. I'm going to paste that and we'll go through it. But for this, we've got, it's a CA-2. She started feeling it October 23rd, August 1st, 2023. She's a postal distribution clerk. Thank goodness for spell check. We're doing a CA-2. Her reference number is going to be her last name, whatever her pretend claim number is, and the date that we saw the patient. This is what I do for reference numbers in our clinic. So Sarah, she's worked as a postal clerk for 12 years. Her job requires her prolonged standing on hard concrete floors, 8 to 10 hours daily, repetitive bending and reaching motions to sort mail packages, and frequent lifting of parcels weighing up to 70 pounds. On August 1st, she began noticing mild stiffness and occasional tingling in her wrists and fingers after a long shift. Over the following months, her symptoms progressively worsened to include persistent stiffness and weakness in her shoulders, sharp pain in her neck radiating into her right arm, and swelling in her wrists. By February 2024, those symptoms have become constant, with intermittent numbness and tingling in her fingers, significantly impacting her ability to perform her duties despite using wrist supports. Modifying her workstation and taking over-the-counter medications, her symptoms have continued to worsen, necessitating medical evaluation. So that is what happened to Ms. Jackson. Now we have exam findings. So this is the exam that was done on her. So we have a cervical spine exam and we have a wrist exam. So we're going to copy that and we're going to paste that in. And what we have here is some decreased range of motion, cervical spine, positive spurlings, decreased sensation at C6, weakness in the biceps and wrist extension, tenderness and muscle spasm along the paraspinals, positive wrist exam, positive Tinel sign, decreased strength, positive phalans, and decreased sensation to light touch along the median nerve. So yeah, she's got some positive exam findings. Imaging findings. So she had a cervical spine MRI in December of 24, which showed nerve root compression on the right side and foraminal narrowing. And she had an EMG in March of 24, and that was positive for her median nerve bilaterally. So we're going to copy that and we're going to paste that in. And then we have the diagnoses that we diagnosed her with, which is cervical disc disorder with radiculopathy and carpal tunnel syndrome bilaterally. And we're going to paste that in. And we're going to hit generate. So remember, when it generates, it's going to generate a summary or a very short narrative. So what it first spits out is not going to be your narrative you're going to want to put in your EMR. It's just, and the reason it is shorter and it is a summary is because AI at this point, it may get better over time, but at this point, AI only allows so many tokens per inquiry. So it's only allowed to like spit out so many characters. So hence, when we go over this, I'm going to show you the prompts that you need to ask it. So the first thing it spits out. So you have to, when it pops up, it's going to go to the bottom. You're going to scroll up. This is the information we gave it. Here is the initial thing it's spitting out. So we have a detailed job description. I am going to copy that. Come to my EMR. Okay, job description, paste. So we have her job description for her clerk position. Coming back to my narrative. So we have a description of injury from the patient's perspective. It basically rewrites it. However, I like what I have here, what my intake person would have gotten over the phone that we've trained them on. So that looks good. I'm going to leave that. But the next most important thing is going to be the medical description of injury. So this is where you're wanting to get, from a medical perspective, what happened to that patient, the mechanism of injury. So that's the first prompt. Obviously, this 3-sentence thing, that's not going to cut it. So we're going to come down, prompt 1, and we're going to click it. When you click that, it's going to populate here. So will you rewrite the medical description of injury with more detail, including all areas of complaint, explaining the mechanism of injury related to the incident? Now, this prompt is going to work really well for a CA-1. Now, for a CA-2, it's a bit more advanced. We need to tweak this a bit. I'd have some canned prompts for CA-2s, but because they're also a little bit different, it's difficult. So, but it's going to be easy how we're going to change it. And so instead of saying related to the incident, I'm just going to change that related to her job duties. Explaining the mechanism of injury related to her job duties. But I'm going to add a little bit more to this. Can you put emphasis on how many years she has worked and the cumulative effect of how often she does her job duties daily that have affected her injuries? Maybe I'm gonna change that to caused. There we go. So I just added a little extra, and this is just using your brain when it comes to your knowledge of what needs to be in a CA2 narrative. So will you rewrite the medical description of injury with more detail, including all areas of complaint, explaining the mechanism of injury related to her job duties? Can you put emphasis on how many years she has worked and the cumulative effect of how often she does those job duties daily that have caused her injuries? Send. Okay. So now we have a medical description of injury, and we're going to read it together. So Ms. Jackson has been employed as postal clerk for 12 years, a role that demands significant physical exertion and repetitive motions. Her duties require her to stand on unforgiving concrete floors for 18 to 10 hours a day, a factor that contributes to cumulative stress on her musculoskeletal system. Repetitive bending and reaching motions necessary for sorting mail packages place continuous strain on her cervical spine and upper limbs. Additionally, the frequent lifting parcels, some weighing up to 70 pounds, further exacerbates the physical demands placed on her body. The mechanism of injury is multifaceted, involving both acute and chronic elements due to the repetitive nature of her work. Cervical spine, particularly C5, C6 level, has been subjected to ongoing compressive torsional forces as Sarah repeatedly bends and lifts. Over time, these forces have led to the herniation of the cervical disc, resulting in nerve root compression. The compression manifests as sharp sensations radiating into her arm, diminished range of motion, and weakness, as evidenced by the positive Sperling's test, and decreased sensation in the C6 dermatome. Moreover, the repetitive wrist and hand movements required for sorting and handling mail have led to the development of bilateral carpal tunnel syndrome. The median nerve, which transverses the carpal tunnel, has been subjected to prolonged pressure, repetitive flexion and extension of the wrist. This has resulted in delayed nerve conduction. The cumulative effects of these job duties over 12 years has resulted in significant musculoskeletal strain, manifesting as cervical disc disorder and carpal tunnel syndrome. The persistent and repetitive nature of her tasks has led to microtrauma and even degeneration of the affected areas, underscoring the direct link between her occupational duties and her current medical conditions. The detailed understanding of the mechanism of injury highlights the necessity for medical intervention and workplace accommodations to address the impact of our long-term occupational exposure. So that's pretty good. I'm going to copy that, and I'm going to paste this here, my medical description of injury. Good. So Melinda, you say, are you able to add the CA-2 prompts on a handout or on the software for medical providers to use? Yes, I think that is a good idea. And maybe we'll make it like examples of CA-2 prompts, because they're not always going to be exact for the particular thing that happened to each person. But I do like the idea of having, examples of CA-2 prompts, if we can add that.
Yeah, Kendra, one thing that we can add is, how if you go down to the bottom of Quick EMR where it has prompt 1, prompt 2, prompt 3, we could put CA1 above that, and then next to it we could have CA2 with prompt 1, prompt 2, prompt 3.
Okay.
And we can change those prompts.
Yeah, I just like it to be more of an example, because if you use the same one every time, it's going to be, as you guys know, if you've written enough narratives, sometimes patients just come in with like the weirdest circumstances and you want to tweak that question. But I like examples of that. Okay, so that was a really good medical description of injury. The next thing that I need is I need to write a medical opinion and diagnosis statement. This is where we're going to state our medical opinion that this is causally related to her work injuries, and then we're going to outline each diagnosis and detail those out. Again, this is what it originally spit out, and that's very simple. It's like a 1-sentence medical opinion and like 2 small things. So we're going to come down and we're going to hit prompt 2, because this is rewrite the medical opinion and diagnosis. And it says, can you rewrite the medical opinion and diagnosis statement with more detail, expanding on each diagnosis with the definition, mechanism of injury related to the incident, and pertinent exam findings? Again, incident, that feels like more of a CA1. So I'm just going to back that up and write to her job duties. And then we're going to say again, comma, add detail, add emphasis on her years worked and the repetitive nature of her job duties. Okay, I'm going to spell check that. Great. Send. Okay, so now we have, in my medical opinion, the conditions experienced by Ms. Jackson are directly caused by her extensive job duties as a clerk, which she has performed diligently for 12 years. The repetitive and physical demanding nature of her work has led to the development of two primary medical conditions, cervical disc disorder with radiculopathy and carpal tunnel. So we have the first diagnosis. This condition involves the disc, which has resulted in nerve compression. The cervical spine is composed of vertebral discs that acts as cushion between the vertebrae. Over time, the repetitive bending, reaching, and lifting motions required in Sarah's job have exerted excessive compressive torsional forces on her cervical spine. This has led to the herniation of this disc, causing nerve compression. The resultant radiculopathy is characterized by sharp sensations, decreased range of motion, and weakness, confirmed by her positive Sperling's test, diminished sensation at C6, and the MRI findings of a herniated disc. Again, the carpal tunnel, we're going to define carpal tunnel here. We're going to mention the mechanism of injury of the repetitive wrist movements required of her handling the mail, and then mention the positive exam findings, the nerve conduction studies. The cumulative effect of Sarah's job duties over 12 years has resulted in significant musculoskeletal strain, manifesting a cervical disc disorder and bilateral carpal tunnel syndrome. The persistent and repetitive nature of her tasks has led to microtrauma and eventual degeneration of the affected areas, understanding the distinct link between her occupational duties and her current medical conditions. These findings highlight the necessity for medical intervention and workplace accommodations to address the impact of her long-term occupational exposure. I like it. If you wanted to dig deeper, you could ask a follow-up question and be like, put more emphasis on how many times she lifts every day and compound that. But we're going to copy that and we're going to come down and we're going to paste that in medical opinion and diagnosis. Paste right there. Now we're going to go back because the last thing that we need to fix is the medical summary and causation, where we're summarizing everything and just basically repeating ourselves so that they can hear it again. So prompt 3, can you rewrite the medical summary and causation with this same detail and include the 5 elements? I'm not going to add anything to that. Basically, it already knows the first 2 prompts I gave it. So I'm just going to say, rewrite this part with that same detail. And ours says include the 5 elements because we're going to break it down for this claims examiner reviewing this and just say that met 1, it met 2, it met 3, 4, and 5. And if you don't know, the 5 elements are what the claims examiner has to pull out of our narrative in order to approve it. So they have to find those 5 things, but we're just going to simplify it by pointing them out. So in summary, Ms. Jackson's conditions are a result of her repetitive occupational duties that she's held for 12 years, the physical demands of her job, including standing, bending, reaching, lifting heavy parcels, has led to significant strain. This strain is manifested in 2 primary medical conditions. Again, we're going to repeat listing them both, and we're going to summarize that evidence again. Again, repeating the mechanism of injury and repeating the exam findings that corroborate it for both. The evidence presented, including diagnostic imaging and nerve studies, clearly supports the causal relationship between her job duties and her medical conditions. Therefore, it is imperative that her claim be accepted to facilitate appropriate medical intervention and support. And then we're going to list the 5 elements. Number 1, she did file it on time. Number 2, she does work for the post office. Fact of injury, it occurred during the tasks of her job, and the diagnosis are confirmed through exam findings and imaging. The injuries occurred while she was performing her job duties, which involve the repetitive and strenuous nature. And there is a clear medical connection between her job duties, so her causal relationship. We're just going to repeat it all. And so we're going to copy this. And we're going to paste that here. And so for the sake of all that, our narrative is done. Besides coming down and, are you ordering anything else on this patient? Probably not. We already have enough imaging. Are you going to recommend some injections? Well, I sure as heck am. She's going to get some trigger point injections. Bam. Work status. Yeah, she's probably going to have some restrictions. She got 18 restrictions. We need DME for her. Yeah, I think we're going to get her some wrist braces. Let's see. 10. Oh, yeah, no, we're going to give her 10s unit. She needs that. What else does she need? She needs some wrist braces. Oh, I don't have wrist braces on here. Okay, note, add that. So we'll just write it in there. She needs wrist braces. Okay. And then obviously spent some, spent FaceTime with her and she's gonna do some PT. Okay, my note's done. Any questions on that initial narrative? Good. And I think it's definitely a great idea. Add, those CA-2 prompts so you can see that. And you guys, and when we upload the other training too, feel free to watch the CA-1. CA-1's a bit easier. Those 3 prompts, like 90% of the time, work perfectly for almost every CA-1, just the way they are. It's the CA-2 where you got to add a little extra. Cool. Yeah, and we're only 25 minutes in.
Hi, this is Victor. I have a question
Yeah.
out of South Bend, Indiana. So under the medical opinion and diagnosis, I often have problems with mine when describing the diagnosis. It adds words like may, could, likely, and things like that, and I have to reprompt it to not use words like may, could, likely, or pain. Did yours do that? I didn't quite pick up on that.
It did not do that this time, but I will say that that does happen occasionally. And what reduces that from happening is the strength of the patient's description of injury of what happened and the strength of your exam findings. The AI is smart enough to just like even, as a doctor reading something, if the patient is wishy-washy in their description of what happened, and then your exam findings aren't really clear as to corroborating those diagnoses, it will naturally throw words like may or likely in there. So if that's happening a lot, I would go back to maybe your technique with pulling a history from the patient, get more detail, and then make sure that your exam findings you're putting in there, the exams you're doing on the patient are good for the diagnosis that you're giving the patient. But and then sometimes even if you do have a great story from the patient and you do have a great exam, sometimes it will throw words like that in there. And then you're right. I just say, please rewrite this and don't use any ambiguous language like likely or could or probable, and then hit send and then it redoes it. And if you do that once, it should fix it for the following prompts. But yeah, that's usually my advice. Make sure you're doing some really good exam findings and you've got good imaging there.
Okay, thank you.
Yeah. Um, okay, so if everybody feels good with this, I mean, we're only 27 minutes in. I want to show you some additional things that you can use this for. Is everybody good with that? Okay.
I'm
So
good. Thank you.
yeah, awesome. Okay, so this patient came in, we wrote an initial medical narrative. In my clinic, the next thing they're going to do is see the physical therapist, or have their, I don't know if you guys use PTs, or they're going to have their initial like rehab eval or get started with rehab. So my physical therapist is going to want to do an initial rehab visit. What really bogs down my physical therapist is writing like the plan of care with short and long-term goals. So what I have here is the exam that the physical therapist did. I'm going to copy that. And so my physical therapist can now come in the next day, they're in with the PT the next day, and he can go to her narrative, scroll to the bottom and say, PT initial eval performed today. Here are my findings. And then just paste it in. will you write me a plan of care for this patient with short and long-term goals? Send. What's cool about that is already populated into this session is the patient's history, the injury that happened, their job duties, their initial medical exam, their entire initial narrative. And now I'm just saying, hey, the PT found this. Write me a PT plan of care. So now all my physical therapist has to do is come in and make sure they agree. Short-term goals, because of their cervical range of motion, enhanced strength and endurance, long-term goals, interventions. We're going to do Therex, manual modalities. Like, yeah, sounds good to me. Copy, and then he's going to come in. He has to do all of his exam. And he's just got to come in and say, what's the treatment plan? Paste. Boom, it's right there. He's got his treatment plan and his notes done, besides copying the diagnoses in. So our PT uses it. The next thing that's going to happen in my clinic most likely is so they're doing PT for 3 or 4 weeks. They're going to show up for their 30-day medical reevaluation. So my nurse practitioner is going to see the patient again, and they're going to come in and give her a subjective input. But then she's going to have to come down here and write a medical summary for what's been going on with this patient for the last 30 days. So all she's got to do is do her exam, her re-exam that she did. And she's going to come back to this patient in the archives. Like, she'll have to scroll and find him. And she's going to say, she presents for her 30-day re-eval. Here are my exam findings. And just paste those in. Here is her subjective input for today's visit. And what did the patient say? Oh, I hate when that thing drops down. Troy, make that thing go away. There we go. So Ms. Jackson reports that she's been attending PT as prescribed, completing sessions 3 times a week. She's noticed some improvement in her symptoms with her wrist strength and neck mobility. However, she continues to have pain in her right shoulder with prolonged activity. She mentions she's still difficulty performing some ADLs like lifting objects and repetitive motions. So we're going to say this is what she said happened. And I'm just going to say, will you write me a medical summary for the assessment portion of today's visit note? Because that seems like that's like the most daunting part for my nurse practitioner is, she can get the patient history, she can pop her exam findings in there, but then she comes down and she's got to summarize like what's been going on with this patient. So we're just going to ask AI to do it. And so AI just said, today's 30-day reeval. She has measurable progress, positive impact for her PT. Her commitment to attending therapy has contributed to improvements. Summarize the exam findings here. Summarize her subjective input that's happened. And then her overall assessment is that she has a positive response to her PT. With increased range of motion. However, persistent discomfort and limitations highlight the need for continued PT as a treatment plan to address ongoing challenges, particularly in managing her pain and enhancing her ability to perform ADLs. Further evaluation and modification of her therapeutic exercises and strategies may be necessary. That sounds great. It's better than anything I could have thought up in the instant, but this is going to speed up her charting. And also it looks really good. And we're going to get fewer denials on future PT because we're like putting it in the medical reevaluation summary that's going to get uploaded in that reeval. That's better. We're going to update our work status and we're going to write continue PT. and that note is done. So overall, like my entire team is utilizing this and just going back and going in and just asking it a follow-up question just to help their notes as the patient is progressing through care. And it's not only is it making them more efficient, but it's making those notes look a lot nicer, whenever especially we're trying to prove medical necessity and not have something. So, though it does happen, and I'm sure, it happens to y'all if you do this enough, um, we get a denial for PT and we need to write a letter of medical necessity. Again, we get a denial for PT. We're just going in here and we're going to the bottom and we are uploading a file. And I have here a pretend denial. This is a letter from DOL saying that they're denying her physical therapy. So I'm going to pop that in the upload file. So what I did is I just hit open file and then I just found it and attached it. Or you can drag and drop in there. And then I'm going to say, we received this denial for PT for this patient. Will you write me a letter of medical necessity for continued PT? I don't think it cares if you misspell, but whatever. And we're going to hit upload. And it's going to read that denial letter for PT. And then it's going to address every issue that was in it and write me a letter of medical necessity that we can then forward on to get her PT approved. And I didn't have to give it any of the other patient's information because it's already in there because I'm just going back to that narrative session on that patient that already has all this info on the patient. This narrative session knows this lady's initial examination. It knows her PT examination. It knows her reeval examination. So it's going to know all that stuff when it writes this rebuttal. So now we have a letter of medical necessity that you can put your guys' information in here for this patient. Dear claims examiner, addressing the issue, her medical necessity. It's going to quote her functional improvement about her problems that she's still having, and emphasize the need for it. And a conclusion, in my medical opinion, I urge OWCP to reconsider. And then you can just copy and paste this onto a Word document, and bam, there's your letter of medical necessity. So that's just going to speed that issue up for your team as well. Any questions on that?
What was that attachment a Word document or PDF? Or
It was
does
a
it matter?
PDF, but a Word document works just fine as well. No, actually, that was a Word document, wasn't it? Let me I'll pull it up. Yeah, it was. That was a Word document that I had there. And it's a Word document because I made it up because this is a pretend patient. So basically I had AI, write me a denial, like pretend to deny this lady. So, just says medical necessity wasn't substantiated, whatever. But most of these will be in PDFs. So obviously if you get it in the mail, your patient brings it into you or your case manager downloads it. Just scan it in as a PDF and it'll upload a PDF and read it just the same.
Excellent. Thank you.
Mm-hmm. Can you write the letter of medical necessity in the note? I imagine, do you have a note template for a letter of medical necessity, or would you just do like a medical reeval and maybe just put it like, a purpose statement at the top? And, maybe put it in. Yeah, I guess you don't know if you would need like a template for that or if you would like do a medical reeval and then just put it. That's a rehab initial visit. Medical reeval. Maybe put chief complaint with a purpose statement and then come down and maybe put it in the medical summary. That would be up to
Right.
you.
We added assessment summary in our template. So maybe we could add it on there. It's just recently we've been getting some physical therapy and imaging denials, saying that they needed a medical necessity. So adding it into the note as well as providing them another letter, which the case managers will submit.
Yeah, I say double up on that. That sounds like a good idea. And if that's the case, I would just copy from here and copy all this from that, like there, and then put that in that assessment, but then also have this letter attached with it.
I agree.
Yeah. But yeah, I mean, and we're evolving, like, just even us being in practice daily and like we're finding new things to use this for. You guys can do the same. Think of this as like it's an archive of all this patient's information, and you can come down here and ask it anything. Like I'm just giving you examples of like how my office uses it, but we're experiencing something new with DOL, all the time. So you might have a patient come in with maybe there's a reconsideration or a request for more information. You just come down here, you can upload a file and you can just ask it in that thing. This reconsideration is a request for more information is attached. Will you reply to this? Or will you write me a narrative based off this information? And then ask it more prompts. And see how it helps you guys in your practice and your flow. This is how my practice flows, but I know all of us have little different nuances based on the type of providers we have in the clinic or how our flow goes. And if you find something that is like working well for your practice and you're loving it, let me know, because number one, it might help my practice, but it can help others who are utilizing this. If you're like, hey, we use it for this and it's really cool, let me know, because it can help others as well. Yeah. Any other questions as we're going through here? Any other like sticking points that you guys are having whenever you're utilizing this that I can help clarify, or did me going through that help clarify it? Cool. Okay, so was this helpful? Like put in the chat if this was helpful for you guys. Awesome. Well, good. Well, I will have Troy and his team take this recording and the recording of our CA-1 training that we did last week and have that uploaded into, so that will go here under videos. So I'll have him put it in here so that you guys can rewatch, or if you have other team members that weren't able to be on here, they can rewatch it. And then also I know that just nature of practice, we hire new or we grow, our teams grow and we got new people, you can have them watch it as well. And then actually what I'm going to do, I don't know if everybody here has my email, but I'm going to put my email in the chat. Let me just do to everyone. So if as you're using this, if you have a question, feel free to email me and just ask me. When I'm available, I'll catch up with you, answer your question, or you have a follow-up question after this. Just email me and ask me, and I'll get back with you. For sure. But I'll give you time for everyone to copy that email if you guys want it. CA-1 tips. Oh yeah, we're getting ready to upload that, but CA-1 tips, let's see. So I think here's our CA-1 that we did. So I'll just be really quick. But the information we gave it was really simple. Geez. Which is basically, he lifted a package, hurted himself, he strained his low back and got a disc injury. So the first prompt was just the one that went with it. There's just the one button, and it wrote a nice medical description of injury. The second prompt, just the one button, and it worked perfectly. And then with this one, some of the team was annoyed with how often the bot puts like little stars and number signs and stuff. So I said, "Will you rewrite without the numbers and stars?" And it did. And then can you rewrite the medical summary with the 5 elements and leave out the numbers and stars? And it did that. And that narrative was done. So CA1s, like when it's a clear cut, like I stepped off the porch and twisted my ankle, I lifted the package and hurt my back, those are really easy. Those 3 buttons work really well. Um, and so that it's just simpler with the CA1 when it's like that. I don't know. Do you have any like certain questions or like examples where a CA1 might be complicated where you think you might want to tweak that question or that prompt? I'm trying to think even just in my little history with just even some recent cases that we've had. It just works, even if it's complicated, even if it's like, I think we had can the AI always leave out the numbers and stars? I know I asked Troy that too, because in the beginning I kind of liked it, but then I actually started getting annoyed with the numbers and stars. And to tell you the truth, I ask it a lot to leave that part out. And part of me is just because I start getting in my head thinking that the claims examiner is reading this and getting pissed. Like, because I feel like if I was reading something, I'd be like, okay, I freaking get it. Like, I can read. But yeah, we'll ask. I'll definitely ask that. Yeah, but like I was saying, I'm trying to think of, yeah, even if there's multiple injuries, like if someone like, I think I had a patient that was like, handing like someone at their door some mail, and their dog jumped out and went to snap, actually bit her hand, but when it bit her hand, she fell backwards down 2 steps and rolled down the hill, and she had like, not only did she have a dog bite and a laceration, she had like, a low back injury and a hip injury and an ankle injury just from like everything that happened. But as long as you have the history of what happened, the exam findings, the imaging findings, and the diagnoses, those 3 buttons worked for that. I didn't have to add much because it all happened like in one incident. It's the extra when you have to try to dig out of AI how they developed a chronic injury over years of service. Cool. Awesome.
Now, do you have any tips of as far as using the AI for medical reeval?
Yes. So yeah, and I did go over that with the medical reeval, even like with Miss Jackson here. So how I use it, the one part of the medical reeval that is the hardest for my team is writing the summary of what happened. Because really all we're trying to get in that medical reeval is we have the patient come in and tell us a new history, right? Like I've been progressing with PT, or PT's okay, and but I'm still having this or I'm still having that. We do our exam, which we got to do, and then it's the summary of like what's going on with the patient and what our future recommendations need to be. So basically, I'm just going in and I'm saying she presents for her 30-day reeval. Here are my exam findings, and I'm copying and pasting that in. And then I'm saying she states that she noticed some improvement. So I'm just pasting in what the patient said happened. Here's her subjective input, blah, blah, blah. And then I'm just saying, will you write me a medical summary for the assessment portion of today's visit note? And then it's writing me this nice medical summary summarizing that she's here for that assessment, summarizing her exam findings, and giving an overall assessment. And we copy and paste that here in the medical summary. So I'm just going in and I'm just asking it that. I'm just copy and pasting in those 2 inputs and then asking it to write that for me. That's how we use it for medical reeval. Cool. Because to tell you the truth, in the past, like before, my nurse practitioner was just copying over the medical summary from her initial narrative into the medical reeval and just leave. And I'm just like, I don't think that, like, that's not really summarizing the medical reeval, is it? That's just repeating what they had before. Like we need to actually be in real time with what's happening because nurse case managers are going to read these notes. Case examiners are going to read these notes. So we want to make sure they're thorough and make sense.
So whenever I do a diagnosis expansion, it gives me a very shallow description of the diagnosis that I'm expanding.
Mm-hmm.
So you would re-prompt it to give more information, or is there a prompt button for that as well? I don't remember.
There's not a prompt button for that, but yeah, I would treat it like you're writing a new narrative for that new diagnosis expansion. So yeah, I would write here, patient presents with new imaging findings showing, and then paste in those imaging findings, right? So if it's, they ended up getting an MRI of the shoulder and there is a slap tear, right? And then you're going to say, will you write me a diagnosis expansion adding this diagnosis, that slap tear? And then send. And then, of course, remember I said AI can only give you so many tokens, so it might be shorter or not. So then I would just use the prompt one, prompt two or prompt three, and just have it expand on that. Or write your own prompt in, like, this is great, but will you write?
Why don't you do a quick little test of that real quick? Because it wouldn't take long.
Okay, what is this lady? This lady's got carpal tunnel and cervical. I don't know if I can. What would she have in addition? Um,
Maybe go to the CA-1
oh,
from yesterday.
let's say, so we diagnosed her with disc degeneration with radiculopathy. Let's go to our CA-1 dude. What is Mr. Doe? Um, so his diagnoses were, sorry, I just want to make sure. It's a lot easier when you got a real patient. We got a fake patient here. So he's got disc disorder with radiculopathy and muscle strain. So let's say we got an MRI and there's actually a herniated disc. Maybe we want to add that. Look at the bottom and I'll say he has new imaging 1/20/25 showing herniated disc at L5. Will you write me a diagnosis expansion adding, okay, quick guys, what's the ICD-10 for herniated disc at L5? You gonna make me Google it? Because I don't know it off the top of my head. ICD-10 L5 herniation. What is it? M51.26. Okay. Oh, okay. Here we go. Oh, I like how it wrote it in like it's a letter. Okay, so we have a purpose statement, right? So I would actually, we want a purpose statement, and then we want the the rationale, the diagnosis expansion, and a conclusion. So I'm gonna be like, will you write me a purpose statement for this expansion? And let's go to our patient here. And let's create diagnosis expansion. Create note. And we're gonna put a purpose statement there. Okay. Purpose of this expansion is to reflect the current diagnosis for Mr. Doe. This is the reason why we're doing it, to ensure hospice facility. By expanding the diagnosis, we aim to provide. Okay, so we got a nice little purpose statement. Where got too many tabs open. Paste that there. So we got a description of injury. So we're just gonna just ask it to write that stuff. Will you write me a detailed description of injury for this expansion? So I would let it spit out what it's going to spit out, and then I would just ask it each thing for that, what blank in your EMR that you want it to write. So will you write me a detailed description of injury for this expansion? So here we go. So that's restating what happened to him. And despite ongoing treatment with PT, he continued to experience, problems and impairments. Recent imaging conducted on this day shows this. Here's the mechanism of the injury of what happened. And new imaging findings of the herniated disc necessitate an expansion. Great. I'm going to copy that and I'm going to paste that here. A detailed description of injury there. You'll put your physical exam findings in there for that day. You'll put your accepted conditions. Yeah, this is where you're going to want that. We might even add some diagnosis. So let's go back and let's say, will you rewrite the medical opinion and diagnosis statement? Will you write me yeah, let's have it do that. Will you write me a medical opinion and diagnosis statement with more detail expanding on the diagnosis, the definition, and the exam findings? So let's see if it does that for that M51.26. All right, well, it added the others. Disc with here's the disc with radiculopathy. It involves the displacement of the disc, the package, diminished sensation. Yeah. So I'm going to copy that and I'm going to put that in there too. So yeah, just think on that. This actually is helping me because maybe we'll do some prompt for diagnosis expansion that are really specific. So the injury sustained, so attributable, we have the disc and we're adding that. Does that make sense? I think this shows that I think we can
Yes,
make.
it does. Thank you. Sorry.
Yeah,
I
I
couldn't
think
find my mute button.
yeah, that's okay. I think this means that Troy, we can probably work on some nice, like, clear buttons to click for or prompts for a diagnosis expansion. Because I'm not super happy with it at first writing like this letter. You know what I mean? I'd like it to be more like, here's a purpose statement for my expansion. Here's my new imaging findings, my diagnosis, and why. I'd like it to be more clear cut like that. Okay, so for reconsiderations, yeah, that's a good idea too. So I think we have some work to do with improving this to go beyond just using it for initial narratives. My main thing here was like really getting everybody writing like clear cut initial narratives, because that if we can get initial narratives looking nice and everybody writing them, using these prompts correctly, then that's going to make using these things for like expansions and reconsiderations really easy to just dive right back into that narrative session and ask it those following prompts. So I think this is definitely a good start. And then we will work on what are those good prompt buttons for both of those things, as well as using it for like the medical summary for reevals. And if you are going to use it for rehab, short-term and long-term goals. So very good. Awesome. See, I learned just as much from you guys, which is going to help make this better for everyone. So we'll post this recording. And like I said, my email is on here. So feel free to email me and ask me anything as we want to improve this as much as we can. So it helps not only us, but everybody else. Well, any other questions before we end it today? Cool. Okay. So remember, email me if you have anything. Otherwise, have an awesome day and let's keep killing it. Bye, everyone.